is Kamryn,
Yes,
and I'm
Kamryn,
from North Carolina.
North Carolina.
I'm with Leadership Initiatives, and I'm here to help. And I want to make sure that everyone feels as comfortable as possible. Yeah, so can you tell me a little
Yeah.
bit about the patient? How old is he, and what's his name, and just the symptoms that he's been experiencing?
Yes. The patient's name is Abdullah Usman.
Mm-hmm.
He's a 4-year-old boy,
Mm-hmm.
preschool child
Mm-hmm.
who presented with a history of passage of bloody stool
Yes,
and
I,
then
I can.
yes, abdominal pain
Okay.
for 1 week. Yes, he's a child to a parent with a low socioeconomic status,
Mm-hmm.
less than $100 per month. Then presented there is associated history of weakness, generalized weakness prior
Mm-hmm.
to this presentation of the symptoms, and
Mm-hmm.
then loss of appetite.
Okay.
And the mainstay is there is associated fever.
Okay. So that fever, does it come and go, or is it continuous?
Let me ask the mother
Mm-hmm.
for you, please.
Yeah.
Zazzabin yana zuwa ya koma ne? Yes, initially it is intermittent. It comes and go.
Okay. Um,
Mm.
and so are there any other symptoms that he's been experiencing with like paler or um any discoloration of the child in general that she's noticed?
Yes, yes, there is associated the palm. As you can see, though he has been transfused, but initially when he came,
Mm-hmm.
the palm is looking whitish,
Mm-hmm.
and
Yeah.
then there is also an associated history of weight of
Mm-hmm.
loss of weight
Mm-hmm.
about a month prior to presentation to the hospital.
Okay.
Yes,
So
but there is no associated discoloration of the eye, but there is associated peeling of the palm
mm-hmm.
of the sole.
Okay.
As you can see, daga kafan shi ne, daga kafan shi. Can you see it? Can you see the sole?
Yeah, I can see that.
Can you see the peeling of the skin of the sole?
Yes, very faintly, but yes, I can
Yes.
see that.
So those are the symptoms, associated symptoms we presented to the hospital with.
Okay, so I'm pretty sure that I have an idea of what this young man has. Is it okay if I run some tests or see the results for some of the tests?
Yes. Which other test?
I would like to see the results for the blood smear to see the parasite count in the child's
The
blood.
parasite count.
And then I would
Ah, that is
also like to see the whole blood count results to see if his hemoglobin is
yes,
low.
yes, that is great.
Hmm.
What other investigation would you like to do to the patient? What other investigation would you like to do for this patient?
So those are the two main tests that I would like to see, but I guess you could probably also run a blood culture just to see if he tests positive for
Yes,
typhoid. I'm pretty sure that he has
yes,
malaria and anemia, but I think it would be smart,
yes,
just given the background of the patient, to just rule out any other possibility of that.
yes. But I think the PCV done was 23%. That is a HB of less than almost 7 point something.
Okay. So yeah, so
Yes,
malaria and extreme anemia. Um,
yes,
so I would recommend for treatment a blood transfusion and um like ACT, so and probably because of the high parasite count, maybe even in addition to that, like an IV of quinine,
yes,
just because it's such a severe and complicated case, um,
yes,
just to make sure that he recovers and experiences the most maximum recovery in the shortest amount of time possible.
and, yes,
Yeah, and so in the future, what I would recommend to prevent this is obviously taking maybe vitamin supplements to ensure iron counts are in the normal range, and then whenever maybe if you're traveling between school or he's playing outside, to wear longer sleeves
yes,
and like full pants, cover as much skin as possible, and
yes,
wear bug repellent, or while he sleeps at night to be in a mosquito net that's covered in bug repellent.
yes, yes.
Yeah,
Would you
so
like to do another test?
so did he test
Yes,
positive for the rapid diagnostic test?
yes.
Okay.
So is there anything you'll do to the patient again? Is there any advice you'll try to give the patient?
Just the wear long sleeves and long pants when going outside in order to prevent mosquito bites and to take supplemental vitamins to ensure a well balanced diet.
Yes. And is there any other thing apart from that?
I think that's everything that I would recommend.
Yeah.
And hydrate
So,
and sleep,
yes.
just to make sure that he recovers well.
Law, yes. Now that yes, we did the PCV is okay to 23%, and still the patient is looking weak.
Hmm.
He has been transfused.
Has he been given IV fluids
Yes,
in
before you
addition?
give the IV fluid, would you like to do another test? There is a test that you'll do before you give the IV fluid. Will you? Can you remember that?
So the
Yes, from
results
there.
for the blood culture to see if he tests positive for typhoid.
Yes.
Yeah.
Uh, what you would you like to check for his electrolyte,
Okay.
and which particular electrolyte will you be expected
To
to go
check
down or up?
the kidney function.
Yes, that's what I want from you.
Okay.
Yes, that is very
Sorry.
good. That is very.
Thank you.
I'm very happy that you get the direction I'm going through.
Yeah. So how
Yes.
does the kidney
So,
function look?
yes. So apart from the kidney function test, is there anything?
I think that would be all that I would do for this patient.
Yes. So I think it's very you impressed me very well actually.
Thank you.
And then I hope you'll try as you try more than this in future.
Thank you.
And then there is one thing,
Mhm.
especially those people they have a very you should have asked of the history of nutritional status of the patient since she is still a child that is 4 year old.
Mhm.
It's very good to ask for the history
Okay.
of the nutritional history of the child
Yes, sir.
since we are dealing with anemia here.
Okay.
Yes, and then one other thing is that we have to look for the cause. The cause, apart from the malaria,
Mhm.
we try to look for the cause of the anemia,
Okay.
cause of other causes of abdominal pain apart from malaria.
Mhm.
Yes, such as typhoid sepsis.
Okay.
Yes, it's very important to check on that also.
Okay.
Yes, and then from the differentials, what will you expect? Since malaria is a parasite, do you expect to see anything from the blood film?
So the blood film, whenever you run the blood film, depending on the parasite count within the body and how severe or complicated the case of malaria is, that will change the result of the blood film. So for this child, since he is experiencing such severe symptoms, I assume that the parasite count will be pretty high.
So that is very good.
Okay.
So from the blood culture, would you like to look for any other thing from the blood culture?
Whenever you do the blood culture, you can see if there's typhoid and see if there's bacterial growth in the culture.
Yes, that is good.
But
That is good.
for that, you also could run a stool sample or urine test for that
Yeah.
because he is experiencing some digestional and intestinal issues. That would probably be
Yes,
a good test to run.
that is very good. You have tried. You have tried a lot. I'm very impressive. Bravo. Thank you very much.
Can you please tell the family and the patient that I hope that they feel better and everything turns out well for them, and that I
Yes.
thank
So
them for letting me have this experience.
yes. Thank you. Yeah. Tana yi miki godiya. Tana ce da ki dan iya daga mata hannu. Ki ce mata, can you see her?
Yeah. Hi.
Yeah, yes. She's saying hi to you also that they're very happy
Thank you.
to have a session with you.
Yeah, and I would also just like to thank you too, Doctor. I'm really
Yeah.
appreciative that you've partnered with
Yeah.
us and
Yes.
given us all of us this experience.
Yeah. Thank you. Bye. Bye. Till next time.
See ya.